There's a public health care crisis in our country. And no, I'm not talking about COVID-19, but systemic anti-Black racism. And experts warn that is putting the lives and well-being of Black Canadians at risk. One hospital here in Toronto is calling for change, one that will transform healthcare in our country.
Women and Black people and Indigenous people, regardless of their socioeconomic status, have the worst health outcomes of any group in Canada.
One of the, quote, stark disparities the president and CEO of the Women's College Hospital Foundation points to is Black infants in Canada are 3 times more likely to die than white infants. One barrier, Black women's access to healthcare services.
Therefore, their babies are born at risk, and therefore they are more likely not to have full-term babies. They're more likely to have babies that are sick at birth.
Black communities are less likely to get referred to experts. For example, these women are diagnosed with cancer much later than any group, when they're in stage 3 or 4, therefore having much poorer outcomes. Bernard says it's like almost having a death sentence.
What we don't know is why, because we do have universal health care, but because we don't do any race-based data or very inconsistent race-based data, we only know the outcome, which is Black people fare much worse.
And because Canada's healthcare system doesn't collect race-based data, experts say it paints an incomplete picture of the health and lived experiences of Black and Indigenous peoples and the key social determinants.
A lot of people think that if you do research on racialized groups, you're looking for racism. And I would say that we know racism exists. What we have to do is measure its impact.
The negative experiences that Black and Indigenous women have within the healthcare system is also a major hurdle. The latest captured on camera. Joyce Ishakwan screaming for help moments before her death, as nurses can be heard using racial slurs. Indigenous communities say this isn't an isolated incident. Bernard agrees.
No Canadian should be undergoing what far too many Canadians who are racialized or Indigenous live through on a daily basis.
The foundation says it's also focused on setting up resources to encourage more researchers from Indigenous, Black, and communities of color. And that matters because these groups have also been underrepresented in key health studies.
Researchers who come from marginalized communities are more likely to conduct research among marginalized communities because that's their lived experience. We all tend to gravitate to what we know best.
On Tuesday, Women's College Hospital is hosting a free Black healthcare summit as experts and advocates discuss how the sector needs to respond to this crisis.
We want to see what can we do to really advance this conversation and be at the forefront of making some meaningful change.
And the latest disparity these experts point to is COVID-19. The virus is disproportionately impacting communities of color here in Toronto. For example, the Black community represents 9% of the population, but 23% of confirmed cases. In Toronto, I'm Faiza Amin for City News.